Hi there, and welcome to another episode of Let's Get Vaccinated, where each week we deliver a healthy shot of science and facts. So, we do two things on this show. We answer your questions about vaccines and the pandemic, and we all learn about how to effectively communicate science because sharing science is how we keep our communities safe. So, if you don't know me, my name is Lucky Tran. I'm a biologist and science communicator based at Columbia University in New York, and I'm the managing director of March for Science. So today we're going to be talking about India. Now, it's been a difficult time for the world because of the pandemic, but now we're starting to see the light at the end of the tunnel thanks to science and vaccines. Now, in richer countries which have wide access to the vaccines, things seem more likely to be returning to normal right now. But it's important to understand that globally, we still have a long way to go. Worldwide, cases have doubled in the last 2 months and are going to surpass the peak at the turn of the year. And in India, around 400,000 cases are being confirmed daily, higher than any other country has seen during the pandemic. So even though we have incredible science and we have this amazing tool, vaccines, that could save so many lives, we need to recognize that it can also widen the gap between the rich and the poor, the haves and have-nots in this world. So pandemic means global, and we are not safe until everyone is safe. That's why, even though things are getting slowly better here in the US, it's important to talk about what's happening in other countries around the world. Now, to help us do that today, I'd like to welcome a special guest, Dr. Asha Shahjahan, who is family and community doctor in Detroit and one of the lead organizers with our partners. This is Asha. Welcome, Asha. How are you today?
Hey, Lucky. Thanks for having me. I'm doing really well. How about you?
I'm doing okay. It's still an intense time. We're working hard, and I'm sure you are. You're doing amazing work. We're seeing the amazing work you're doing. But yeah, thank you so much for coming on the show and talking about this important subject today. And I guess first of all, I'd love to check in with you because now is such a difficult time for the South Asian community. Although things are slowly getting better here in the US, I know many have families back home that they are really concerned about. So how are you doing?
Yeah, I'm thankful and grateful that most of my family is doing well and they're safe. But I think it's just hearing about what's going on in India has been just completely heartbreaking. There are plenty of my friends who are having family members that are passing away. I had several close friends who've lost their parents, multiple family members. I mean, it just kind of brings back what had happened here in the United States back last year, March and April, where it was just chaos. And the death was just happening left and right. And I think it was really difficult to hear and watch the news coverage on it because it started reminding me of like, oh my gosh, it's happening again, but now it's happening in another part of the world. So I think although we're optimistic that COVID seems to be sort of getting under control, at least here in the United States, it's not the case around the world.
Yeah, absolutely. And it can be so tough. It's already tough being an immigrant when you have family elsewhere and to not be able to be there to help protect them and help them in these situations like this. I feel that deeply. And a lot of my friends from India and in South Asia are feeling that right now. And so our love here at Much for Science goes to everyone's families, who are sort of going through much in this difficult time. So maybe we can start maybe you could give us a summary of the situation over there, how what's happening right now. How's it escalated? What is it in comparison to the US right now?
Yeah, so I think some things to think about is a lot of people are just wondering, like, how did this happen? Like, what is going on where, a lot of the world is doing a lot better, and why is India not doing better? And so a couple things to just bring up. I think one of the things is that there has been a chronic lack of investment in public health in India. If you look at their GDP in general, it's about 3.6% of their GDP goes towards public health. And just to give you a reference, in the United States, we spend about 17% of our GDP on health. So this chronic lack of investment in public health has been a big issue in India in general. And they were lucky in the sense that the virus was sort of under control in the beginning of the pandemic when a lot of other countries were suffering and going through all their spikes and waves. And part of that has to do with the fact that they did lock down well. I think people were afraid and they were masking and they were staying home. And it did good for them. But I think what has happened is that there has been emergence of these variants, which I'll talk about, particularly the one that is surfacing in India is the B1617, and now there's talks of the B1618. And so these new variants are highly infectious. They spread very quickly. And so I think what's happened is that people started getting more lax about the public health guidelines in terms of masking and distancing. And there were several super spreader events that occurred over the last month. This includes several religious gatherings and festivals. And just to keep context, these religious gatherings had about 4.8 million people gathered without masks, right next to each other. And then also there was, 5 major elections, like 5 states had major elections with election rallies. So these super spreader events, really just made this pandemic so much worse in India. And then I think the last thing to mention is the fact that although India is the number one, vaccine producer in the world, it was very poor vaccination efforts internally in terms of getting their population vaccinated. So when you have all of this going on, I think that's what sort of led to this crisis. And currently now it's still, just not a good situation. There is still lack of oxygen. There's still lack of hospital beds. People don't have access to healthcare providers and medications. It's really, really a sad situation.
Yeah, absolutely. And I think that answers Jacob's question of what led to the surge in the first place there. Thank you for your question, Jacob. And please, as we're doing this, please do leave more questions in the comments and we'll try to get to them. We really appreciate your attention in discussing this because it's an important issue to discuss right now. Our next question is what took so long for it to get so bad there? And I think that's an interesting point, right? Because I think early in the year, in January, people thought India was over the hill, right? It was in the clear. It didn't see as bad a situation as here in the US or Brazil or other places. And so people thought this would be fine. The vaccine is coming out, so we'll be fine, right? So why did it just suddenly get bad now and it wasn't bad before?
Yeah, so I think part of it is, as I mentioned before, is that there were these several super spreader events. So there were some variants that are highly infectious that were starting to emerge. But I think once you started having these events where there were no masking, people were allowed to gather, and of that large of a caliber, it just started spreading like wildfire. And then in addition to that, the fact that the vaccination efforts were not ramped up to protect people, and people were sort of laxing in terms of thinking that, oh, it's really not that big of a deal. We're over the hump. We're done with our surges, despite the fact that most of the scientists had predicted that India would have a second wave. So I think there was just a combination of things that led to it becoming so bad right now. And again, as I mentioned, the lack of public health infrastructure or investment in public health. I mean, most countries, when they see that things are bad around the world, they want to stock up on their supplies. They want to make sure that, the physicians have what they need. Hospitals are ready to go as a just in case. And I think that just didn't happen.
Yeah, and it is interesting psychologically, right? Is that I think the vaccines are amazing, but there is this danger of what people call vaccine euphoria, right? And sometimes if a rollout is slower and you ease up on restrictions too quick, then a situation get out of hand. And I think India is seeing that now, unfortunately. So I hope, we can pull it back from there.
Yeah, and if you look at, the population is 1.3 billion people. It's a lot of people to get vaccinated, and you need to start, as soon as possible to get people vaccinated. And only 2.8% of the population is fully vaccinated, and that's about, I think, 176 million doses have been given, and 38.2 million people have been vaccinated. So it sounds like a lot of people, but when you're looking at how many people reside, about 22% of the world's population is in India. So it's a tragic situation, and hopefully, they'll be over the hump soon, and we'll be able to, get vaccines in arms and get their way out of this.
Absolutely. And John says, is the surge directly related to how dense their population is? I think you've been saying basically yes, right?
Yeah, the population is very dense. It's in the best of times, it's very difficult to social distance in India. It's just sometimes people, are even thinking it's unrealistic. But I think the fact that there was mass gatherings happening without masking, I think that probably was one thing. But then also the fact that with the emergence of these variants, again, these variants are a lot more infectious than the main ones that we were originally seeing here in the States, although, it's now being found in various parts of the world. But I think the combination of the variants and then the gatherings, I think, is really what caused it.
Yeah, absolutely. And we see those things. Everyone's familiar with the graphs now. People worry about the exponential growth. And I think what doesn't help exponential growth is if you have a really dense population, right? Because that really amplifies things quickly. So, yeah. And I think you said this. How different is the variant there that is causing the surge?
Yeah, so the variant there is, so the ones that has been seen is the B1617 and the B1618. And both of those variants it's a double variant as opposed to the single variant. And then there's talks about a triple variant actually as well. So when you have multiple variants, it becomes more difficult for vaccines to work well. The good news is currently the B1617, the dominant variant that's being seen in India right now, has been tested against the current vaccines, and it seems that it is effective. But that is the whole purpose of getting vaccinated, is that the more people that are vaccinated, the less likely the virus has time to sort of replicate and mutate. And so as less people are vaccinated and more people are walking around spreading the virus, whether symptomatically or not, there's more of a chance of more mutations happening. And the more mutations that happen, the more likely that vaccines may be ineffective in the future and that we might have to modify the vaccinations. And we really want to avoid that as much as possible.
Yeah, absolutely. And I think this answers also Jesse's question to what status of the different vaccines and the variants, what effect and to what degree. I think we are waiting on more data for this too, as we say that. But I think from most of the epidemiologists I've talked to is that, so the thing with the double variants is the mutations are not necessarily new. They've seen them before in other variants around the world. So we have some idea on what they do. Like they increase transmissibility. They might be a bit tricky in evading the immune system, but from the other variants, we know the vaccines work well. So I think the hope is that as more data comes out, the vaccines will hold steady and do well against this variant too, right?
Yeah, absolutely.
Yeah, and so I guess another question is, what happened? Because, India is the world's biggest vaccine producer, right? So how can there be a shortage when this is the case?
Yeah, so what happened originally is that although, like we said, India makes most of the vaccines in the world, they exported a lot of their vaccines to surrounding countries. And it's unfortunate because you would think that they would vaccinate their own population before exporting, but I think they had more exports than imports. And then, now, I mean, they have the Covaxin and the Covishield are both, made within India. And then Sputnik V has been brought in. And, there's talks about bringing other vaccines to India to help out with the efforts. But I think that's kind of what happened. They make vaccines, but they were exporting most of the vaccines. Because again, I believe that they really thought they were over their second, they didn't think a second wave would happen and that they were kind of over COVID-19. So maybe it was a false sense of security. And that's why I can't emphasize how important it is that we have to be really vigilant against this virus and be very careful. I mean, we all want it to be over. I mean, you do, yeah. I do, we all do.
We all do, yeah.
We just have to be careful.
Yeah, complacency is such a big thing. You can have all the technology and know-how in the world, but if you don't have the right attitude, then things can slip really quickly. I'm actually interested I heard this, I think in January, that there might be problems with vaccine hesitancy as well, which was part of not being urgent enough in India. I'm not sure if you've heard anything like that. And does that look something, is it similar to what we see here in the US, or are there different factors over there that contribute to hesitancy?
Yeah, so there's multiple factors with vaccine hesitancy in India. So one thing that I think is a little bit different than here is that the lines to get vaccinated are long. People are waiting in line for 2 to 3 hours to get vaccinated, and they're not necessarily socially distanced. So I think people that maybe even want the vaccine are afraid to go out and get it because they're saying, what if I get COVID while I'm waiting in line? So I think that's a logistical issue that is something that's different than that's happening here. In addition to that, there's a lot of thoughts around different types of medicine. So like Ayurveda medicine or homeopathy, and people feeling that that is sufficient and that they may not need vaccination because they're protected by these other schools of medicine. And, you know, I'm not against natural medications or natural things such as like Ayurveda or homeo. But I do think that there is a false sense of protection. It does help boost your immunity, but it's not going to 100% prevent this virus the way that a vaccination would help protect you. So I think there's a little bit of that happening. And then, of course, the misinformation is rampant. I mean, we all know we're in an infodemic. That's the case here around the world. But I think in India, there's just been a lot of misinformation about ways that things that can protect you. In addition to that, there's a really low rate of health literacy. Again, I'm going to plug the fact that public health infrastructure is not well funded, so you don't have great messaging. You don't have a lot of efforts to help people learn and understand about the virus in the same fashion as you would in other places. And there's so many people. It's like, how do you get to all the people? There's so many different languages, different people, different socioeconomic statuses. I mean, there's people that live in the slums, that people live in very high socioeconomic areas. Some people speak English, some people don't. I mean, it's very difficult to have like a very serious campaign going forward on the vaccine. Not that it can't be done, but it is challenging. So I think those are some of the things. And then, of course, the things the same as here. People are worried about side effects. People are worried about long-term side effects. People are worried about how quickly that the vaccine has been produced, but not understanding the science behind the fact that, these vaccines, the science behind it has been around, for decades. So I think it's all kind of the same things as here with a couple other extra challenges.
Yeah, you're right. And it's something that I always say is this is the greatest science communication challenge in history. And I think the diversity of India and how big India is amplifies that, right? It's just so hard to get a message out there. And I think it really plays into what we know well is that it's trusted messengers. This is what you're working on with This Is Asha. This is what we work on with March for Science. Trusted messengers in the community who can really cut through that difficulty of scale, right, to get that message out there and make a difference. So that's why we focus on these conversations here.
I will say one thing is that, in the past, India's done fantastic with their vaccinations. So, yeah. I mean, they're actually a role model country in terms of getting their population vaccinated. So I think, again, the COVID-19 virus is maybe just a little bit unique in the fact that it's a global pandemic. So the misinformation has gotten quite vast.
That's interesting.
Yeah. So I think that's a little bit of a challenge. But I think overall, if you look at the past, when it comes to vaccines, India's done pretty well.
Yeah, absolutely. Kelly Townsend says, can the US say donate vaccines? And I guess what can the US do to help in this situation?
Yeah, I mean, absolutely. I think we did ship over quite a few vaccines over to India. So I think many countries are pitching in to help out India, which I think is beautiful. Countries are working together to get vaccinations there. And if you're looking for how you as an individual can help, there's several ways that you can do that. I think first and foremost is if you have friends and family that are from there, is to talk to them, because you want to make sure that whoever you donate to is a legitimate source. A lot of times we go ahead and put in donations and sometimes the supplies don't get to the places that are needed. And so I think that's really important to sort of vet the resource that you may want to donate to. But I also think just that in helping to invest in the public health infrastructure in India, supporting organizations that do that, and then also supporting organizations that fight misinformation worldwide, those are great ways to really help out in this pandemic, not only for India, but around the world.
Yeah, absolutely. I'm going to backtrack for a sec because I do want to talk about the donating vaccines issue, because it's something that I think it's really important to pay attention to. Yeah, as you said, the US has committed with the AstraZeneca doses, which are approved in India, but they're not being used here. I think the US has committed to shipping some of those over there. There's more details that need to follow. So that's a good step. And the other part, of course, is intellectual property. And I know the Biden administration recently committed to, waiving the patents for the vaccines. There's a lot of details that go into that. There's a lot of policy advocacy that needs to go into that. But that's a good step too. So I think for us, and things that we can do is keeping the pressure on rich and powerful countries who do control the rights and distribution and sort of the doses of the vaccine. We can sort of push on them to do the right thing and share with the world, because it's a pandemic. No one's safe until the whole world is safe. So we need to push on that, right?
Exactly. That's the whole vaccine equity. I mean, we cannot, like, just because countries have more money and more resources, if they hoard it, it's not going to get us anywhere. And it's unfortunate that there are people who really want a chance to get the vaccine around the world. And, here we might be wasting doses of vaccine. So I think it's just it's a really sad inequity that we have in the world.
Yeah, absolutely. I'm going to throw up this list of one of our viewers, Ruchi, suggested some organizations to donate to. As Asha says, you should vet them yourselves. She said they were trusted organizations, but we wanted to share that for a member of our community. We'll throw some resources in the links below as well, so that you can sort of do your own sort of work in sort of seeing where to donate to. But I think it's important to stay engaged and really, amplify voices, do policy advocacy, whatever you can do. It doesn't always have to be donations. Just staying engaged is really important. So thank you for everyone for joining in today and talking to us about this. And I guess before we let you go, I'd love to hear about, you're doing some work, with telemedicine as well, right? In India. Could you tell us about the amazing work that you're doing at the moment?
Yeah, so there is a project called Project Samvedna, and it was brought together with the Sukarma Foundation, Sati Aid India, and Telangana RMPs. And so it's kind of a grassroots movement where a couple of leaders just put out a Google form and asked physicians from around the world to come and get together and see if we can do some kind of help hotline to help support not only the physicians in India who are so burnt out and just don't have the bandwidth and capacity to guide people who are trying to stay home and out of the hospitals, but also to help the general public. And so through this outreach, there's about 150 physicians from the United States, the UK, from Dubai, from Australia, I mean, around the world coming together so they can cover all the time zones. And it's a 24/7 helpline to help guide families through the COVID crisis. So any questions that people have, they can call and ask. If they're wondering, should I go to the hospital or not? Or what can I do to stay safe at home? These are things that are provided via these telemedicine consults. And we're partnering with organizations there in India with healthcare professionals on the ground. And all the guidelines are, based on the Indian guidelines, based on the All India, the AIMS University, which is the All India, I can't think of it now. I'm saying All India Institute of Medicine. So that is some of the cool things that are happening there. In addition to that, we're doing an awareness campaign where we're doing live Facebook town halls for people in various regions, and they will be in various languages. So far we've probably reached about like 4,000 some people just with one of our lives. So I think we're trying our best to really reach people and see how we can help, not only with messaging, but also with fighting misinformation and providing help via telemedicine.
Yeah, that's so awesome. And again, it's so important to share information and provide access to that. That's a key thing that we can do in this pandemic to help protect everyone. So we'll leave a link in the description on how people can connect with you with that so that they can sort of, if they can offer to help, that would be fantastic.
Yes. Yeah. Just digital message me, or you can go to Project Samvedna on Facebook. So, yeah.
Awesome. And thank you so much for joining us today, Asha. Always great to have you on the show. And we really appreciate all the work you're doing with India and all the work you're doing with This Is Asha. And yeah, really appreciate everything that you do.
Thank you so much, Lucky. And thanks for everything that you guys do with March for Science. I mean, you guys are always elevating the voice of science, and really great that you're doing an episode on India and really focusing not only on what we're doing here in the world, but all over the world. So thanks.
Absolutely. We'll see you again soon. Bye, Asha. Thank you.
Bye, Lucky.
All right, on to this week's Fauci fave.
My favorite.
All right, so each week during the Fauci fave, we spotlight people who are doing amazing grassroots work helping others during this pandemic. And so today we'd love to highlight the work of our friend Lisa Priya Kanjugam, a 9-year-old climate activist in India. In this emergency, she's been doing a lot to help people get much needed oxygen to children and families. And we'd love to show some of the work she does right now.
now, I am just recovering from a very bad COVID I had. But I'm sure I'll be, I'll meet you guys, and I'm totally, support you in whatever you do. You can always find me there on the helping you.
Ma'am, we are always there. Team Lysipriya is always there to help you all. To save one of...
I trust you.
Thank you, ma'am.
Thank you so much, dear. Thank you so much. God bless you, my dear. God bless you. Thank you.
Thank
We'll
you,
connect
ma'am.
shortly. Thank you.
Get well soon.
Thank you.
Best
Take
of
care
luck.
now. Bye.
Bye-bye. Nice to talk with you.
Thank you, Team Lysipriya and Noble Foundation, for helping us out in this need, and I would really like to express my gratitude for this help, and it means a lot to us and our family. Thank you so much. God bless you all.
Amazing, amazing work. And I'd like to read Lysipriya's fundraiser here. And we dropped the link in the comments if you want to donate and contribute to this campaign. So Lysipriya says, my country is facing the worst crisis for humanity ever due to the super tsunami of COVID-19. Thousands of people and minor children are dying daily due to a shortage of oxygen. Our hospitals are going through tough situations. We urgently need more oxygen concentrators to save as many lives as possible. This campaign started as a self-funded mission to help people across the country get immediate access to oxygen concentrators. Many people are dying due to shortage of oxygen. Some children have already lost both their parents. Please help me in saving lives. We can't wait only for the government. A little bit of your support can make a huge difference. Thank you, Lysipriya, for all you can do, for everything that you do. It's incredible, incredible work. We've dropped your fundraiser in the link, so please help everyone. And thank you, everyone, again for joining us today for another episode of Let's Get Vaccinated. Please go get the vaccine if you're eligible. And please remember, the pandemic doesn't end when you're vaccinated. We must keep fighting for the safety of everyone. No one is safe until everyone is safe. Good night, everyone, and we'll see you next time.